Thank you.
Okay, thanks very much, Amanda, and thank you very much, Mia, for those introductions. Just actually one thing before we progress further, I think there's a little bit of confusion about whether people should put questions into the Q&A or the chat, and it will probably be a little bit hard to do both simultaneously or to monitor both simultaneously. Mia, do you want to, or Amanda, did you want to just give a preference one way or the other so that people can have a sort of single flow for these things, if that's all right?
So if we can use the chat, that would be really helpful, because that way we can group similar questions together. If someone's not able to use the chat, we'll just ask them if they could raise their hand using the small icon on the bottom of the screen. And that way Mia or one of the guest speakers at the time can actually refer to that person who has their hand raised.
Okay, great. Thanks very much, Amanda, just for clarifying that. So once again, if I could also acknowledge the traditional owners of the land on which we're meeting and pay my respects to elders past, present and emerging. As Mia said, I'm one of the deputy secretaries in what's the COVID-19 response in the Department of Health. I'd like to acknowledge also that for many of us here today, we have many friends and family overseas who also might have been affected by COVID, and the situation, which has been obviously a distressing and quite in some certain countries of in some countries even a catastrophic kind of situation, and that this has been a very upsetting and quite a stressful situation for many of us, particularly in a situation when many of us aren't able to go overseas to be with friends and loved ones. And so it's really important that we all understand the stresses and acknowledge the stresses that this unfortunate situation places on all of us. Also, I'd like to note that for all of us here today, I imagine this is not a situation that we particularly want to be in terms of being in another lockdown again. It is unfortunate that this is a disease which is very highly infectious and unfortunately can have quite catastrophic health consequences for some people in the community. And so the decisions to go into things like a lockdown are not at all taken lightly, but are ones which are put in place because of the risk that this unfortunately very highly infectious disease could have in terms of the impact on the health of those who are near and dear to us. But in that context as well, there's also an important message to all of us that we can all do our part, take our part in actually being able to support each other, and also being able to take steps to actually enable us to get on top of this outbreak and hopefully put COVID-19 behind us if we take the right steps to essentially combat this disease. I'll come to some of those steps in a couple of moments, but first of all, I just wanted to give everybody a little bit of an update on what the situation is at the moment. So for those of you who haven't been watching closely over the last day or so, we are now at about 50 active cases, or more than 50 active cases in this outbreak. And that outbreak has been a number of different sites, including in the north of Melbourne, starting off in Epping, in Port Melbourne, and then in 2 sites in aged care with 2 aged care homes. And as all of us would know from the previous second wave in later last year, those outbreaks in aged care, of course, are particularly concerning because of the potential impact it can have on older members of the community. So in terms of where we are at in terms of activity, we had more than 20,000 vaccinations yesterday, which is a really, really good result. And we've had a lot of increased interest in vaccination as well. And my colleague, Dr. Ben Cowie, will be talking about that further. And in terms of the vaccination program and the steps that you can take to protect both yourself and your friends and family through being vaccinated. We also had more than 42,000 tests, pathology tests, COVID-19 tests completed yesterday. This is an enormous number, and we think we've had more than 300,000 tests undertaken in the last 4 or so days. When you think that actually our previous record was about in only 30-something thousand tests, and now we've had 4 or 5 days in a row of more than 40,000 tests, and in one day even reaching 56,000 tests. Sorry, that's a bit of a mouthful. That's a really good sign of our members of the community stepping up and making sure that they are clear of COVID by being tested. And this is a really important message to all of us, that if we have even the slightest of symptoms, like a scratchy throat or a headache or something like that, it's still very, very important to get tested so that we can make sure that there isn't undetected chains of transmission of COVID passing through the community. And in addition, there are more than 320 exposure sites listed on the health website. So those exposure sites are places where people who have contracted COVID have been, and where there is a risk of having picked up the disease. It's really important that everybody in our community is across those exposure sites. And if you have been in one of those exposure sites, following the instructions from the Department of Health about what you should do in that context. So as I was saying, it's really, we all have a role to play here today in terms of moving us from a stage where we can hopefully bring an end to these circuit breaker restrictions. The support of you and your families and your friends is very important for us to be able to essentially to conquer the disease. And the other thing here is it's really important as you, as members of the community, can have, and also not just the behaviours that you adopt yourself, but also encouraging your friends, family, and your colleagues in terms of what are the right things to do, but either in person when you're living with them, or in terms of contact you might be making via Facebook or electronic media, or on social media as well. Each of you can play a really strong part in terms of encouraging the right sorts of behaviours during the circuit breaker lockdown. So in terms of what the circuit breaker lockdown places obligations on all of us at the moment, there are 5 key things that the circuit breaker restrictions are the rules apply on all of us. Rules that apply on all of us. They provide us with only 5 key reasons to leave home. And the reasons why we restrict people leaving home is because the more we move around, the more opportunities it gives for the virus to spread. So by reducing that movement around and that interaction, it gives us the opportunity to get on top of this outbreak. So those 5 reasons for leaving the home are the following. First of all, you can leave home for shopping or for essential food and supplies, but you need to do so within 5 kilometres of your home or as close to home as possible. Secondly, you can leave the home for exercise for up to 2 hours a day, but again, this must be within 5 kilometres of your home. Third, you can leave for care and caregiving, including medical care, or to get a COVID-19 test. An important thing about this is that you can move more than 5 kilometres to get a COVID-19 test. So if you are getting a test and it looks like your local testing centre might have a long queue for it, it is possible for you to look on the department's website to identify a site which might have a shorter queue and to travel to that site for a test as well. So that way we can balance the demand for tests across the whole system. And we have more than 200 testing sites across Melbourne. So there are opportunities to get tested across the whole of the metropolitan area. The 4th reason that we can leave home is for authorised work and permitted study. And there's a list of authorised work which can take place, again, on the department's website. And finally, and most importantly, I think, the other 5th reason to be able to leave home is to be able to get a COVID-19 vaccination. And of course, these vaccinations are very, very important things for us to be able to ultimately conquer this virus, and also to protect yourself and your family from the potential consequences of being infected with the disease. As well as part of these circuit breaker lockdown restrictions, face masks are mandatory, both indoors and outdoors, whenever you leave your home. And there's a whole range of international evidence that suggests that if you wear a face mask, this reduces your chance of both getting infected and infecting others quite dramatically. So that's a really important thing that everybody can do to protect ourselves from COVID-19. So in terms of what sort of a call to action, what it is that we want all of you to be able to do, first of all, the key thing is to keep across those exposure sites. So those exposure sites are being updated all the time, because with every new case, there unfortunately is an increase in the number of exposure sites, which are places where people have been, where there is a risk that somebody might have picked up a COVID infection. And so if you keep across those exposure sites and then follow the instructions associated with those exposure sites, that was a way to get on top of any potential risk of infections, and also to make sure for yourself that you are safe and you haven't been exposed to COVID-19. Secondly, it's really important that everybody gets tested if you have even the slightest of symptoms. So these might be only minor things like a scratchy throat or a bit of a headache, but unfortunately, for some people, the symptoms and ultimately the consequences of COVID-19 can be very severe. And as we know, several hundred people did die from COVID-19 during the last wave. So it's very important that even if it's only a mild symptom for you personally, that testing to understand whether or not you have COVID is a really important step to take to protect both yourself and your family and loved ones. Thirdly, it's really important to follow the public health directions. So as I was outlining before, there are only 5 specific reasons for which you can leave your home, and the requirements around mask wearing. And these are things that we've put in place to protect yourselves, but also the whole community as well. And finally, it's, and this is a big change from where we were in the second and first waves, it's the importance of also getting vaccinated. So all of you here who are 40 years old or older, you have the opportunity now to get vaccinated. Whether you, this makes no difference whether you have Medicare eligibility, what sort of visa status you are, what's your country of origin, all these sorts of things. If you're 40 or over, you're able to get vaccinated now. So we do encourage all of you who are able to come forward for vaccination. Now, thank you again for all of your participation, both this evening and also for all the steps that you're taking as a community to protect ourselves and to hopefully get on top of this this outbreak. Back to you, Mia.
Thanks so much, Pham. Great overview. There's some really, really great questions in the chat, but actually Simon is working on the front line tonight. He's out in local public health unit land tonight, and has got some pretty important work to get back to tonight. So I really wanted to invite Simon to give us an update of the public health situation, if that's okay. And we'll kind of try and get all our questions for Simon up front, and we'll let him get back to the very important work that he has to do tonight. So Simon, would you like to give us an overview?
Thank you very much, Mia. And I would also like to begin by acknowledging the traditional owners of the lands from which I'm coming to you today. And that is the Kulin people of the Wurundjeri Nation. No, the Wurundjeri people of the Kulin Nation. I do apologize, getting the wrong way around. I am new out here at CEFU. I've recently moved out here from working in the department, so still finding my feet and getting familiar with the territory. But it's great to be able to join you today, joining the community in which I will now be working and helping with this coronavirus response. Look, I'd like to echo everything that Phuong has said this evening and those really key messages that he's put forward. But I'd like to give you a little bit more information about the current situation. And as Phuong had mentioned, we have just over 50 cases now linked to the current outbreak. Where it started up in those northern suburbs, and we've since then seen cases linked to a workplace out in Port Melbourne, and then from that exposure sites really across all of Melbourne and even out into some of our regional areas. So it's really an outbreak that has grown very quickly and really reiterates how rapidly coronavirus can spread in general. We're dealing here, and for those on the call who like the technicalities of it all, we're dealing with a B1617.1 variant. So that's a very technical way of saying it is a variant of concern. And this is a variant that originally was first identified in India, but is now spreading in many countries around the world. And there are variants that have come from other places as well throughout the response. And what we're seeing with this particular variant is that it does seem to spread quickly. The time it takes from one person getting infected to spreading to another person has been very, very short in some cases, 24 to 48 hours, which is much shorter than we had seen previously for the average spread during wave 2. More concerningly, we've had a number of examples of transmission where it looks incredibly likely, and the working hypothesis is that the spread has been with very, very minimal contact. So strangers who don't really know each other, haven't really had that direct face-to-face contact that we know, but may have just briefly passed each other in a shopping centre or somewhere similar. And there's been a handful of those exposures in relation to this particular outbreak. So it really does require us all to be super vigilant. It reminds us all to make sure that we're wearing masks all of the time when we're outdoors in any public places. That it's really important, as it does provide that added protection and helps reduce that incidental spread that we've been seeing. So the key areas I did want to touch on in relation to a particular group that we've got here tonight is we've got a number of exposure sites that are in this sort of southeastern part of the Melbourne area that have had multiple exposures. That includes the Bay Street shopping strip in Port Melbourne, as well as the Clarendon Street shopping strip in South Melbourne. Both of those areas have had a number of exposure sites, a number of shops and businesses in those areas where cases have attended. And so we're very keen for anybody who's been to those areas in the last couple of weeks, if they have even the slightest of symptom, just be anything that makes think they might be a little bit unwell, please go and get tested. It's really important that we can pick up any of those incidental spreading events that we have been seeing, and that's the way we'll do it. So really wanted to draw focus to those two particular sites. The other thing I just wanted to mention tonight is that we're constantly reviewing and reassessing the exposure sites and revisiting what we think the risk is in those settings. And we make an initial risk assessment on the information that we have at hand. But as we find out more or see further evidence of spread, we sometimes upgrade that risk assessment. And we constantly review that. It's happened a couple of times already within this response. It looks like we will be regrading some more exposure sites this evening, and we're always adding new exposure sites every day. So I do urge you to check into the exposure sites website very regularly, have a look to see if there's been any changes, if we've upgraded any. Some of the shopping centres that we've seen cases in are going to be upgraded to tier 2 exposure sites. And so this is something that we urge you to sort of continue to check in on and have a look at. I did just want to touch base quickly on the tiering classification that we use. Mostly the exposure sites are either a tier 1 exposure site or a tier 2 exposure site. Tier 3 is a bit of a tricky one. It's really the same as everybody in the community. Tier 3 just means if you've got symptoms, go and get tested. Well, that applies to everyone, so we won't worry about that too much. So the tier 1 exposure sites are those higher risk exposure sites where we think there's been that higher degree of exposure. And so for people who have been at those exposure sites within the relevant time periods, we are asking that they get a test immediately, and then they quarantine at home for a full 14 days from the point of their exposure. So that's those highest risk tier 1 exposure sites. For the tier 2 exposure sites, we've determined that they are a little bit lower risk. And so we don't want to just lock everybody in their homes for 14 days without a good enough degree of risk to do so from a public health perspective. So the tier 2 exposure sites are those where we think there's that lower risk. For those exposure sites, we ask that people get tested immediately, that they stay at home, they isolate until they get their negative result. But as soon as they've got their negative result, they are free to carry on within the confines of the current restrictions. I would add, though, with those tier 2 exposure sites, that it is still very important that people monitor for symptoms. Just because you've had a negative test doesn't mean you won't come down with symptoms and become a case after that. So if you had a negative test today, but you get symptoms of coronavirus in 2 days' time, you do need to go back and get another test, because it may be that we tested you in that period where the virus wasn't detectable, and then it will become detectable when you get those symptoms. So that is something that is really important for people to remember. Look, they were really the key things I was going to touch on. And I do, as Mia said, I do have to go off and do some frontline work. I can stick around for another 10 minutes or so. So I will shut up there and provide some time for some questions.
Thank you so much, Simon. Look, there's some really great questions in the chat, so I might see if I can catch you for just a couple of these before you go. The first one is, if an infected person is wearing a mask and visits the supermarket, for example, how does he or she pass on the virus?
Yeah, so the masks that people are wearing, they do provide an added layer of protection. They do reduce that risk. If a case is wearing a mask and people who are in an exposure site are wearing a mask, that level of risk is reduced. And that's where we might move to a tier 2 exposure site, because we think the risk is lower. The masks that we do when we wear when we're moving around do increase the protection, do lower the risk, but they don't eliminate the risk altogether. And so we do sometimes still at those exposure sites require people who have been wearing masks to go and get a test and to isolate until they get a negative result. So we do know that sometimes the virus can come out the side of the mask and go into the air. If you cough a lot, it can hang in the air for a little bit. And so it can still be spread, and that's why you see in hospitals and certain settings many of the staff wear those higher type masks. They're called the N2 masks, so the P2 masks that provide that added layer of protection. But it still can spread, but masks are really important in reducing that overall risk.
Thanks, Simon. Just reiterating the importance of masks there. Another question about symptoms. So the question is, are we releasing a new list of symptoms? Because someone read on a medical website that there are different symptoms associated with this particular strain.
So we're not changing the symptoms. We are asking anybody with even the mildest of symptoms to go and get tested. And that might just be feeling a little bit unwell. At this current time, we are seeing people with the mildest of symptoms testing positive. So if you have anything that's just feeling a little bit unwell, a bit achy, a bit feverish, a little bit of a scratchy throat, a little bit of a runny nose, any of those things, there are the classic symptoms that everybody's come to know about: loss of sense of smell and loss of sense of taste. The very classic symptoms that people are well aware of now. So we won't be changing anything at this stage, but being ultra vigilant.
Great, thank you. Just maybe one more for you, Simon, and we'll let you go. From all of the exposure sites, how many people are currently in hospital and how many people are in intensive care?
Well, that's a really tricky question. It might be one we'll have to take on notice. I'm more familiar with the cases with our new local public health unit model, which is a fantastic way of moving forwards with the management of coronavirus so that we can work very closely with our local communities and understand our local communities. I'm very familiar with the cases that we've got within this, the SEFU catchment, the South East Public Health Unit catchment, and we don't currently have any cases in our catchment in hospital. However, I'm a little less familiar with the cases in the other local public health unit areas. So I can't answer that fully, but Phuong might be a little bit more across the statewide picture.
Yes, I can actually answer that question. So as I understand it, there are 2 cases currently in hospital out of the 50 odd or so. One of whom had been quite severely ill and had been in ICU for a while, but I think may be now out of ICU. And then the second case was one of the people who was in aged care who's been taken to hospital for observation to make sure that that person's condition doesn't deteriorate.
Great, thank you so much. I think I'm just quickly flicking through the chat. There are quite a few more questions in there, but I can't immediately see any that are necessarily for you, Simon. So feel free to stay on if you'd like to. I'd also like to point out that we've got Ben Cowie, Dr. Ben Cowie, working very hard in the background, answering questions in the Q&A. So good to see we've got you working back there, Ben, and we might come back to you for a little while. Maybe just one for you, Phuong. Today, Mr. Weimer urged that people who had visited certain shopping centres should go and get tested, and one of those was in Bay Street in Port Melbourne. Does this include the whole street, and is there a date period around that? And maybe it's a good opportunity to talk about some of our different approach today in terms of those broader shopping strips and shopping centres.
Sure. So the reason why we have put some of those shopping strips onto the and why Jerome made that announcement today was the concern that Simon mentioned about some transmissions occurring, which have been basically through relatively casual contact through people who've been shopping relatively casually through that shopping centre, and they might have managed to pick up COVID from a stranger or something like that. So on the website there are some particular times and places where there are particular shops of higher concern within those shopping centres, so and those shopping strips. But in addition, what Jerome has asked is also that people who've been shopping in those areas over the last fortnight or so, they also take steps to get tested. And this is because we want to be as an abundance of caution. We want to make sure that through those kinds of casual interaction, there isn't a risk that somebody has picked up COVID from one of those interactions through being at one of those shopping strips.
Great, thank you, Phuong. And maybe just another one related to exposure sites again. So once the exposure site is singled out with a time and a date, how do we know it will be safe to go back to next time? And if the person is there for a known time, then how long should we avoid going to that place?
So once the site has been identified as an exposure site, then it goes through a process called a deep clean, where essentially what we do is cleaning teams are sent in to make sure that all the surfaces anywhere that somebody might have touched, all those sorts of things, are thoroughly cleaned to remove any potential that COVID might have been retained on any kind of surface or something like that. So once that deep clean has taken place, then it is safe to return to those kinds of businesses or those kinds of location. Obviously, with the current lockdown restrictions in place, there probably are going to be few reasons for you to go to a restaurant or a bar or wherever those particular exposure sites have been. But in general, once normal life resumes, once we're outside of lockdown, then yes, it would be safe for you to return to those sorts of location. Obviously, when you do so, it's still really important to adhere to the COVID safe guidelines. So things like checking in appropriately with the QR codes, sanitizing your hands, and also, of course, wearing a mask in accordance with what the guidelines are at that point in time.
Fantastic. There's another question here for someone who received a text message today. So this person lives around Dandenong Market and received a text message today to say that if they were in that Dandenong area and they had symptoms, they should go and get tested. Did you want to make any comment about the text messages that went out today?
Yes, so certainly. So there a number of text messages have gone out in particular geographic areas. for people, encouraging people to get tested if they have symptoms. There are a number of sites in Dandenong Market which are listed on the website as being exposure sites. So again, if you look at those carefully and check whether you were in that area at that point in time, there may be particular instructions to you about what you should be doing. But more generally, because of those casual contacts, we are encouraging, and that risk of casual people being infected with COVID-19 through relatively casual contact, we are encouraging people in those geographic areas also to be tested if they have symptoms.
Great, thank you, Phuong. There's a question here about are we doing multiple tests for primary close contacts, because in case the initial test is negative, but then someone develops symptoms after that initial test, and do we test them again after that?
Yes, absolutely. We definitely do that. So, and this is one of the reasons why we do also have the 14-day quarantine period for primary close contacts. So one of the things that can happen with COVID is that it can incubate in people's bodies for a period of time, for up to about 14 days. And so we do actually require that people who are primary close contacts are tested a number of times during that 14-day quarantine period, and including at the end of that period to make sure that they're clear of any disease before they are released from quarantine.
Great, thank you, Phuong. I'm just noticing that there are quite a lot of questions in the chat about vaccine, in both the Q&A and in the chat. And I know that we've got Dr. Ben Cowie and also Alicia Stark online with us today. And I'm wondering if either Ben or Alicia might like to jump on and address some of the questions that you're seeing. I know that you're reading them, Ben, because I can see that you're answering them as well.
Sure. So yeah, Mia, are there any in particular you'd like me to address? Hi, everybody. It's great to be here tonight. Is there any in particular you'd like me to address in the first instance, Mia?
Yeah, absolutely. I'll give you one to start with. There's
Sure.
a really good one in the Q&A. So is Pfizer only available at the vaccination sites, or can GPs administer Pfizer too if someone meets the eligibility criteria?
So the initial rollout to only a handful of GP practices with Pfizer vaccines occurring this week. And that's only a very limited number, and it is quite complicated in general practice, but also in health services to use Pfizer vaccine. It's quite a complicated vaccine to handle. So it's only really just starting out. So 99% of all Pfizer over the next few weeks will continue to be through state health services rather than through GPs.
Great, thanks so much, Ben. Someone else here who got their AstraZeneca on the 28th of May, and they're just asking if their immunity has been built up yet. So they've just had their first dose on the 28th of May.
Okay, so in 9 days' time, you'll start having a detectable immune reaction to your AstraZeneca vaccine. So we know that it's really within the first 2 weeks of vaccination that we can detect a significant effect from the immunity. A really good point to note about the AstraZeneca vaccine is some people ask about the 12-week spacing. Does that mean that I'll sort of get COVID between the 2 doses? And the answer is no. The immunity doesn't wear off between those 2 doses. And in fact, there's a very significant, sorry about the background noise, everybody. Lockdown has an impact on telecasting Zoom as well. So there's a very significant first dose effect with AstraZeneca, and the data from the UK after the first dose of AstraZeneca vaccine showed a 90% reduction in hospitalizations between the first 2 doses of the AstraZeneca vaccine. So don't be worried that there's a 12-week spacing. You will have an immune reaction, and it is a very significant degree of protection.
Excellent, thank you so much. Another really good question, what's the grace period for the Pfizer second dose? So I think that's what's the kind of window during which you would need to get your second dose.
So it routinely scheduled between the 3 to 6 week mark after the first dose. So generally it's recommended to have it at, well, certainly not earlier than 21 days or 3 weeks after the first dose. Routinely recommended to have it scheduled in the 3 to 6 week window. There's no problem whatsoever if for whatever reason you can't get along and get vaccinated within that 3 to 6 weeks. If you get it done, you know, up to 12 weeks, and noting that again, the United Kingdom, their routine spacing between Pfizer doses in their program was 12 weeks. So no problem, but certainly routinely scheduled 3 to 6 weeks is not an issue.
Great, excellent. Another really good question in the chat. Can people book the vaccine just at one of our, at their clinic, at their GP clinic, or can they get it from a mass vaccination site?
They could do either, but they're local GPs. So there's hundreds and hundreds of GPs across Victoria that are vaccinating against COVID-19. They're doing a great job. As I said before, the vast majority of GPs are providing AstraZeneca vaccine. Because of the guidance from the Australian Technical Advisory Group on Immunisation, that the Pfizer vaccine is preferred for people under the age of 50 years, that really a lot of people 50 years and over are going to their GPs to get vaccinated with AstraZeneca. You can choose to get AstraZeneca if you're eligible and want to receive the AstraZeneca vaccine through your GP. You can choose that. But really, for people aged 50 years and over, whether it's your GP or the state system, you'll be getting AstraZeneca. And I see a question right at the bottom there from Mukles about, is the symptoms of the second dose of AstraZeneca worse or better than the first one? This is really interesting. So the second dose of AstraZeneca actually has lower side effects than the first, but it's the opposite for Pfizer. The second dose of Pfizer vaccine has a higher amount of side effects than the first one. So that's a difference between the vaccines, which is interesting. But certainly the AstraZeneca second dose is better tolerated than the first. So if you've got a headache or a bit of muscle aches and pains after the first dose, you're less likely to get them for the second.
Fantastic. There's another really good question here, and I've seen this one a few times. So this one is, can the vaccines be mixed and matched? So someone's daughter had the AstraZeneca vaccine for the first dose and wants to know if she could have Pfizer for the second dose.
So no, if someone's had the first dose of AstraZeneca, unless they had a very serious side effect, then they're eligible to have the second dose. That's certainly what I'll be doing. I had my first dose of AstraZeneca just on 12 weeks ago now, so I'm looking forward to my second dose. And no, we can't mix and match. There's some research going on that overseas, looking at antibody, which is immune responses after the second dose, different doses of vaccines, but that's not currently, we don't have enough evidence to make that change for the whole program. It's still under being researched. So no mixing and matching, same vaccine each time.
Great, thank you. I might just answer a question here on testing, and I've seen there are a few questions around about testing. So someone said that they live in Port Melbourne and they're really keen to get tested but can't get an appointment until Friday. I really want to encourage people to have a look at our website, and our team will put that in the chat now. And you can have a look on the website. There's a map, an interactive map on the website, and you can see where your closest testing site is. But the other great thing about the website is it also tells you the wait times. So there are many sites, there are a few sites across Melbourne at the moment where there's very limited wait site, and the really good one is the Showgrounds in Flemington. So very, very short wait times if you can drive to the Showgrounds. It's a drive-through site. Less than 15 minutes. There are quite a few others, and the guys will put those in the chat for you. Fantastic. I'm wondering whether I can see hands. I don't think I can actually see any hands raised, and I think that's because, oh, I can. All right, I'm just trying to see if I can see hands raised, but maybe I can't. Can someone in support let me know if that's possible or not possible? Not possible, hey? Oh yeah, I can. Great, I'm seeing some hands. Okay, could I ask Frank Barber, would you like to ask your question? Frank Barber? I think Frank's muted. Is he able to be unmuted? Okay, maybe I'll try Dalal Smiling. Dalal, would you like to ask your question?
Okay. Can you hear me?
Yes, we can.
Hello.
Welcome.
Hi. Thank you. Look, we're working in the Southeast there. Now, if we have a lot of clients and people that we work with who are reluctant to have the AstraZeneca, and they're not in the age group to have the Pfizer, but would be willing to have a Pfizer, is there an issue why people cannot choose to have it, if that's going to mean that they will get vaccinated? I mean, it doesn't matter what we say, you know, if they have certain fears, they have certain fears, and we're not going to be able to, doesn't matter what you say, they've got their own issues about why not, why they don't want to have it, but they're willing to have another one, the Pfizer, but at the moment it's not available to them.
Sure. So I can answer that one. The reason is there's just not enough Pfizer coming into the country. So if we wait for everyone to get Pfizer vaccine, we won't be vaccinating most Australians until the end of the year. And we'll be susceptible to outbreaks of COVID-19, just like the one we're going through at the moment, in an ongoing sense until the end of the year. The reason that Pfizer is prioritised for people aged under 50 years is because side effect associated with clotting after the AstraZeneca